Hi, sturdy women. Hi, sturdy friends. I hope you're having a good week. I hope you're feeling good in your body. Today, I want to answer more of your questions. Last week, I made a video about what I eat for lipedema and how that's helped me lose more than 100 pounds, reduce my swelling. Today, I want to dive into another really popular topic, which is surgery. When I sent out the survey, which I'll put a link to in the description, I got a lot of questions like, have I had surgery for lipedema? Do I recommend surgery? Is surgery for lipedema permanent? How do I find a doctor? Does insurance cover surgery for lipedema? Remember, I'm not a doctor, I'm not a surgeon, I'm not a nutritionist, I am just a woman with lipedema, but I'm going to do my best to answer some of those questions for you today, or really rather kind of point you to other resources that will help you. Before we get into all of that, though, I want to say a huge welcome to all of our new subscribers. We're so happy to have you in our community. If you haven't subscribed yet, go ahead and just click subscribe below, and then make sure you click the little bell so that you get a notification each time I post a new Sturdy Woman video. And then if today's content or anything else on the channel is helpful to you, please do like and share so that we can reach more people and give them hope and help on their journey. Okay, first question is a really easy one. Have I had surgery for lipedema? No, I haven't. I have managed my condition with conservative treatments. I'm going to put a link to my conservative treatment playlist up above, and that will kind of walk you through some of the different things that have worked for me. Like many of you, when I was diagnosed by a doctor. I was told there was nothing I could do about it, that the only option I had was to have surgery, and I just knew that was never going to be an option for me. I have a ton of student debt, and I live in an expensive city, and I just couldn't imagine, a world where I could pay out of pocket for a surgery. So that really sent me down this path of looking at conservative treatments, which is also why I never imagined I would make this video, but I want to be responsive to your interests and what's important to you. So that said, I have not had surgery. I haven't really looked into it because I've had so much success with my conservative treatments. At this point where I am with my body, I don't feel a need to pursue it. But it's a very personal decision, and you may have a reason for you that it makes sense. And I would really encourage you to sit down and get clear on what that reason is, because that's going to help you kind of identify who might be a good doctor for you to work with. Reasons that people consider pursuing surgery include pain reduction, skin reduction, mobility, increased mobility. So, if you have really large, heavy legs and it's preventing you being able to move around, which is really important for your lymphatic system and getting things moving, that could be a reason. And then, of course, people also are unsatisfied and self-conscious about their body and feel like their quality of life could be improved by having surgery. I just really encourage you, sit with yourself and get clear on what it is that you're hoping to get out of surgery. And that's going to help you really figure out, is this the right option for you, and who's going to be a good surgeon to work with. I didn't pursue it because of financial reasons. This whole question of, does insurance cover lipedema? This is really a dynamic and shifting question. Over the last couple years, women have been taking insurance companies to court and winning. The traditional surgery that is done for lipedema is liposuction. And of course, liposuction is considered a cosmetic procedure. So traditionally, it hasn't been covered by insurance. But like I said, women are winning cases against the insurance companies that have denied them. So the tides are turning a little bit on the insurance situation. And so if it's something that you are interested in, it's worth kind of, if you Google, you'll find websites and places where people are talking about this. And also, I'm certain that the doctors and surgeons are really clued into this. And if you reach out to a lipedema surgeon, they'll be able to kind of talk to you about insurance and guide you through some of that. So look for that. You may be able to get it covered. Traditionally, they've said no. The last few years, that is changing. So that's liposuction. Finding a doctor. I would really encourage, there's kind of two suggestions I have for that. So I recommend getting in the Facebook groups. I know not everyone likes to be on Facebook, but there are some extremely large, extremely active lipedema Facebook groups, like with 50,000 members or more. And constantly people are posting before and after pictures of their results with surgery. They're posting about their experiences with specific doctors. Some of the doctors have YouTube channels and other social media where they are kind of promoting their practice and their specific technique. One thing to know is most of the doctors have like different techniques that they believe in and that they practice. Techniques both for the liposuction and also for the pre and post care and things like that. And it seems to vary widely. A great place to learn more about patient experiences with surgery, the surgeons themselves, is the Fat Disorder Resource Society Conference, FDRS, and they have all their videos posted for free online. I'll put a link to their YouTube channel below. I checked right before making this video. All of the videos from the 2023 conference are now available. I did attend the conference in person in Atlanta, and I can tell you many surgeons were there in person, recruiting patients, meeting with patients, had former patients there. They gave presentations where they were talking specifically about their approach to lipedema, liposuction, and removal. And so that's a way to learn more about the specific surgeons. And if you attend in person, you can connect with them that way. Last year, 2023, the conference was in Atlanta. 2024, the conference is going to be in April in St. Louis. So that's an option if you want to connect with other patients, connect with doctors, and learn more about the research. But of course, if you can't attend, they do always post the videos for free on their YouTube channel, 6 to 9 months after the conference. So I don't know, consider that, check that out. St. Louis is a hub for Southwest Airlines, which is one of the most friendly airlines for what are called passengers of size. They do have a passenger of size policy, which may allow you to buy 2 seats for the price of 1. At my larger size, I did take advantage of this and have success with it. So you can Google, read more about that. But FDRS will be in St. Louis in April. That's a great place that you could connect with surgeons if you just want to explore if surgery is something that you want to pursue. I will say at the conference last year, someone did ask the panel of surgeons very directly, is lipedema surgery permanent? Will it come back after surgery? And there was kind of a unanimous response of, in order to have really successful long-term results, you need to also pair it with some lifestyle changes. So just be aware of that. While liposuction for lipedema will physically remove the nodules and some of the diseased, lipedema tissue, it won't fix the underlying mechanism, your sluggish lymphatic system, the inflammation, the connective tissue disorder, like all of those constellation of things that made it happen to begin with and that make it really complicated to treat. So just be aware of that. If you do pursue surgery to maintain your results, your doctor may kind of suggest some lifestyle changes to maintain that. Just be aware of that. We've talked a lot about liposuction, other things that people consider doing, bariatric surgery. I have heard of lipedema surgeons recommending bariatric surgery before people have the liposuction surgery. That's going to be a really personal conversation with you and your provider. But I have generally heard that you'll lose weight in your non-lipedema places, but it's not going to shift your lipedema. Skin removal surgery, it's something after you have a lot of weight loss, you may feel like you want skin removal surgery just to kind of tighten everything up. I do know people who have had that, people who have lost much more weight than me, who then doing keto, who then went and had skin removal surgery. So that's something that you may also consider for your lipedema. Again, I don't think that's usually covered by insurance though. What else did you ask me about? I think I've covered just about everything. Like I said, I haven't had surgery. I'm not an expert in surgery. I never imagined I'd make a video about surgery. But please, if you're comfortable, share your experience below in the comments. I know people who have had surgery and just thought it was exactly what they needed. I also know people who had a lot of pain and were very unhappy with their results. So I encourage you, check out Facebook, see patient experiences, see what their before and afters look like. Watch some of the FDRS videos. There are videos from the doctors, also videos from the patients with great experiences, patients with negative experiences, and just kind of educate yourself about the different options and the different ways that it could potentially work out for you. That's it. For more about me and my journey with lipedema, lymphedema, venous insufficiency, you can head over to sturdywoman.com. I would love to see you there. Mwah! I'll see you next time.